Good afternoon. My name is Tim Killian. I'm the Public Information Liaison for Care Center of Kirkland. We are here doing our daily 1 p.m. briefing, which we will continue to do so long as we feel there's new and emerging information to update. I'd like to start again. I know I keep saying this, but to give praise to the heroes who are here involved and working in the facility, the staff and nurses who continue to treat the patients with care, the EMT and firefighters who continue to come and treat our patients with dignity. I'd also like to thank the families for the incredible amount of patience and grace that they've shown during a very difficult time for all of them. We're extremely grateful. We continue to receive food and flowers and well wishes from the neighborhood, from churches. All of that has been incredibly helpful. So what I'm going to give you now are new updated numbers that are much more certain than what I'd given you yesterday. As of this morning, on-site residents, we have 21 positives, 12 negatives, 12 pending tests, and 4 inconclusives. That gives us a total of 55 total positives that are associated with the facility, which includes 34 that are in hospitals. So again, there's a difference there of 10. Some of those 10 were included in those who had transferred out of the facility in the last several days, and that hadn't been made clear to us at the time. Starting back at top, we now have a total of 63 patients who have been transferred to hospitals. That's a change of +4 since yesterday. There has been no change in the number of deaths associated with the facility. Again, we hear rumors of deaths, but it remains very difficult for us to coordinate with the hospitals which patients are which have already been reported to us and which haven't. So we keep working on those numbers. But as of today, we have our number of 26, which says 15 that had died in hospitals and 11 that had died within our facility, has not changed. The current number of residents are 49. That's a decrease of 4 from yesterday, which is reflected in the 63 that have gone to the hospital. Number of residents that are showing symptoms, that remains 7. I think there's a +1 on here. That shouldn't be a +1. That remains 7. And again, those numbers can fluctuate. It's not always the same patient. All residents have been tested. There's new information on employees. We have 64 employees who are showing symptoms. Again, we started with 180 employees. We have 64 that are showing symptoms. Yesterday, I had indicated that there were 5 that had returned to work. That was an error. There are only 2 that have returned to work as of now. Some of those other 5 were pending return and had indicated they felt well enough to return, but have not officially returned. Testing has begun on employees in earnest through various measures. As of now, I have 30 plus or minus employees who have been actively tested for the virus. Those tests are happening off-site in coordination with the Department of Health.
Sorry, what was that number again?
30 plus or minus. So on the back of this sheet, there's been a question, what criteria do we use to clear an employee to return back to work? That's a criteria given us directly by King County Public Health. I've included a letter that shows an example of what an employee must meet, the standard that they must meet before they return. And those employers are being approved to return by way of the Department of Health or the King County Public Health. What it says is, if you have tested positive for COVID-19, you should remain under home isolation for 7 days or until 72 hours after fever is gone and symptoms are better, whichever is longer. So that's the criteria that King County Public Health is giving us and is subjecting our employees to. There were some questions from yesterday. Let's see if we can get those. There was a question about when we reported to the health department about respiratory outbreak within our facility. On February 26th, we made a report directly to the Department of Health that the level of symptoms or outbreak that we had seen reached what we call an outbreak. That happened 3 days prior to us being informed that one of those tested positive for COVID-19. Going back in time, we actually began to discourage visitors on February 10th due to the level of respiratory illness that we were experiencing within the facility. Again, it's not uncommon for us at this time of year to have influenza outbreaks. So on February 10th, we had started decreasing and discouraging the number of visitors. And then again on February on February 29th after we received that first report of a positive. There's been questions about visitors. The visitors logs we have are self-sign-in sheets that each visitor signs when they enter the facility. On February 29th, we did make a full calling of all first family contact information for all residents within the facility to inform them that we had a positive test from within the facility of COVID-19. There was a question on from who exactly did the strike team come, the additional nurses and doctors. That's Health and Human Services. There was a question regarding mental health and the well-being of the residents. We are short on social workers. That's one of the areas that we've struggled to maintain that level of care. We're working on it, trying to get additional help in. We have not received any outside mental health counseling teams, and that's something we would like to add to our staff in the coming days. There's questions about nurses from other locations. Prior to this event, it would be common for nurses to transfer between facilities. It's not a high number of nurses, but there will be frequent overlap between nurses working here and working at other facilities. Once after February 29th, those nurses that came to us from other facilities have not gone back to work at the other facilities in which they may have been associated. So those nurses who came here from other facilities are continuing to work here and not working at the other facilities. I do have information on, there was a question about employees being paid. There's been a company-wide decision that all full-time and part-time employees who are regular staff will receive their regular pay, whether they're here or not, through the 13th. Further decisions will be made after the 13th. I think some of you may have seen that Governor Inslee made some announcements this morning regarding aid with that. We will be in contact with them as well to coordinate what we're doing and what the state is doing as well. And finally, for those of you who stick around later, at approximately 3 p.m., we are scheduled to receive a full site cleaning from ServPro. They're an outside industrial cleaning agency. We just want to give you a heads up. They will likely exit their vans in full gear. That's per their own protocols for cleaning and in combination with the CDC. They will be doing, again, a full cleaning within the facility, all hard surfaces. Those cleanings will happen within rooms. It will be on a case-by-case basis whether or not residents are moved out of that room or kept in the room while that cleaning is ongoing. But that will depend on each individual resident and their level of symptoms or their individual circumstances.
Is this the first full cleaning of that kind?
No, I am not aware. As staff tells me, it smells like a swimming pool in there. There's been ongoing cleanings. I don't know. I'll find out whether or not ServPro specifically has been here before. That I don't know. But they will be here today, and they just wanted you to know that there's no elevated status for which you'll see them come out in full body suits. That's just what they do per their protocols.
On the 55 total cases, I just wanted to be clear. You were saying that 21 are currently at this facility.
Correct.
And then 34 are at hospitals.
In hospitals, correct.
Okay. And then also along those lines, when you said the strike teams were HHS, was that federal or state?
Federal Health and Human Services, I believe.
Of the 26 deaths that you mentioned yesterday since February 19th, we know that 18 are linked to the virus. What's the status on the investigation into the remaining deaths?
Again, for example, post-mortem tests are outside of our purview. We continue to ask for those results, but reporting has been difficult, to say the least. Again, because this is split between multiple hospitals and multiple agencies. We're doing the best. We feel like we're getting a better handle on it, but to date, we still have no results reported back to us on post-mortem deaths, nor can I confirm that those patients are being actively tested.
It sounds like there's a lot of confusion on the state level. Are you happy with the government's response to the crisis unfolding inside?
I would say we continue to work with them. There are things that we hope for. There are things that we would like to see, but we are. It feels like we're reaching a better state now. For us, this is day 11, I believe, for us. There are things that we have asked for. So, for example, testing of employees is now happening. So we're relatively pleased that those steps are now being taken.
Is there enough testing kits for all the employees inside?
So we are not testing inside. So those employers are being coordinated in off-site testing locations.
And there's enough testing kits for them all?
I can't speak to that. We've done 30 plus tests. My understanding is that they do now have the off-site testing capability for all of our employees. It's just been a matter of scheduling them to come in.
When
They're discouraging.
When you contacted the Department of Health on the 26th, before the shutdown happened on the 29th, did you think that this outbreak could be coronavirus?
We had no medical reason to believe that. The symptoms didn't appear different to us than a typical influenza.
So Tim, if you guys started discouraging visitors on the 10th, why did they go ahead? How did they do that? Did they email or call? And then second,
No, what we do
why
at
did you then have the Mardi Gras and the parties after that? That was in the weeks after that.
So it's a soft discourage. It's not a hard discourage on the 10th. What we do is we put up signs that say there is an influenza, there is respiratory illness occurring in the location. This would be considered a soft warning. It's not. It didn't become a hard stop until the 29th. So, per normal protocols, we do operate as normal as we can during an influenza outbreak. That's a common occurrence here. So those events happen for the well-being of the residents here. So we post signs, we let visitors know what is going on, but we aren't stopping at that point. At that point, it wasn't severe enough that we felt we needed to be canceling events. It wasn't outside of the scope of what we normally deal with within this facility.
Tim, can you tell us if you've gone through your visitor log? This morning the governor talked about new protocols
Yeah.
to keep all the visitors written down and keep that log for a month.
Yeah.
What's been done to notify visitors here?
We have that, but we do not have the manpower at this point to reach out and communicate with any visitors. And we don't always have exact contact information. As I said, we did call the primary contact of each family associated with a resident. You guys are helping us communicate out to the public. Anybody who may have visited this should be speaking to their doctors. If they're experiencing symptoms, they should be taking care of themselves appropriately.
So just to make sure that I'm correct, you made a report to the Department of Health on February 26th that you had an influenza outbreak.
Correct.
Got it. And when did the LCC, did the Life Care Center try to contact the CDC when they also contacted the Department of Health?
On the 26th?
Or at any point around then?
It would have been on the 29th is when all that contact would have happened. We had no medical reason to believe that our patient had COVID-19. Their symptoms seemed consistent with the influenza outbreak that we had within the facility.
And why is the county reporting that there are two patients from here who have passed at Outbreak Hospital? They have their specific around their age range, but you guys aren't able to report that. I mean, that was reported 3 days ago, I believe, on the county website.
Because there's no requirement for the hospital specifically to report that back to us. We're having to call various hospitals and check up on various patients. But for various reasons, again, there can be a difference between the numbers we've already reported, including some of those, and and other organizations not knowing that we reported this number and they're just reporting it out. So there's a bit of a difference that can occur between what each organization is for. There's no central location at this point for that we're working with that is coordinating all of these numbers.
And the
So
4
the
who
county
left
is saying
overnight,
that
was that
19 of the
COVID
20 deaths
related?
are associated with this like Care Center.
I'll take this first.
I'm sorry,
The
was
4
that,
deaths.
with the 4 people,
So-
not 4 deaths, but the 4
I
people
mean,
who
sorry,
left,
the 4
yeah.
people transferred out. There were COVID-related symptoms in some, and in others not.
I see, so not only for that reason.
Correct.
You know, the county is associating 19 of the 20 deaths into the county with the facility.
I'm aware of that number. Again, we're working our spreadsheet to verify that. So as I said, we have a range of potentially 26, and we don't know because of, for example, post-mortem tests. We don't know if those tests have happened and have received positives. We have not been told that. So there can be a difference in the number they're saying, but at the same time, with our number of 26, that could fit within that range as well.
Do you have a sense for how many employees, so we've got 180 employees, period, and then about 115 or maybe less, since you said 5 are back, as you would only 2 are back. Are those the employees that are being tested, or are all 180 being tested?
My understanding is potentially all 180 will be tested.
Okay.
Where's
And
the
do you have a
off-site
sense
testing
for
location?
when they'll be tested and when the
I think
results
there's
will be
various locations, and I'm not sure exactly. They might be being sent to different locations, but I can find out if that's one location and update you on that.
And we're
You
seeing
said
this.
there are 2 employees that return. There's 3 that are healthy. Is there any indication when they will return to work?
We want employees back as soon as we can get them. So my understanding is I think they still have to go through this process with the Department of Health and to be cleared. I'll update you as soon as they come back.
Cheryl, any information as far as where this could have started here? Did any employee travel? And we're just still trying to figure out.
We still have no information on what might be called a patient zero here. We don't know.
Are you technically, like, even legally, I don't know what the term is, but under quarantine? Like, can your residents leave? I'm not saying they are, by the way, but maybe elsewhere. Can your residents leave and go get Starbucks? Like, what is the protocol for you guys to deal with that?
We are not technically. The quarantine is not to the level that we would physically stop a resident. Again, residents and families are still able to make a decision on what the best location is for that resident. Again, many of these residents need a level of care that families would be unable to provide at homes. We are in a position to stop casual leaving of the facility. So if somebody in a wheelchair was trying to get out, we could stop that, but we can't stop them if the decision has been made with their family that they would like to treat them elsewhere or take them to another
But is that the
location.
protocol? Like, are the instructions like to try to stop someone from leaving? And could you tell us why that is? Just wondering.
I don't have it. I'll look and see if we have an official protocol around that, and if CDC. I don't believe that CDC or any government agency has imposed upon us a protocol relative to that, but I will double check on that.
But what is the company's guidance on that?
I'll see if we have an official policy. I can't say it at this point.
Sorry,
On
I just have this-
219, there was a person transferred out of here, the very
Correct.
first person whose test came back. But the 219, that's the date where 219 comes from. But then on 224, there was a second patient who was transferred out of the facility, and you actually got that test back, and that's what caused the lockdown.
Correct.
I'm wondering, that first patient who was taken out on 219, when did their result come back?
It was a couple of days after that. It was, I think, the first or the second, somewhere in there, that they then went back. And I don't know if they went back and retroactively tested that person since the other one had already tested positive. But yeah, there's a difference there between the staging of the first patient was not the first result that we received.
219 first patient, but then the result comes back on when?
It was approximately the 1st or 2nd of March, I believe.
Do you know
Okay,
if-
one more question and then we'll wrap it up.
Do you know if any nurse or doctor here worked at Providence Medical Center?
I'm not aware of whether or not that is true.
And have any patients that have gone out, the residents that have gone out hospitalized, come back or recovered in any way? And if they
We
did,
have
did they come back
received some returns, but not in the last 3 or 4 days. Prior to that, we did receive, and again, part of that was that there was no other place for them to go. so they
So
were returned.
I'm sorry, we hadn't been told this. When did you